Okay, for today, I'm going to discuss about caries risk assessment. So, caries risk assessment, in caries risk assessment, no, the past caries experience, current caries index, oral hygiene measures such as the use of fluoride toothpaste and mouth rinses, the presence of calcular deposits, presence of deep pits and fissures, the level of Streptococcus mutans, snacking habits of the patient, and the salivary flow of the patient. All help assess, the individual caries risk and predict the dental caries progression. So, in early childhood caries, it is an obscure and frequently ignored health disease affecting the quality of life of children. And early childhood caries is a strong predictor of dental caries in permanent dentition. So, all these factors that I have mentioned are being considered in deciding whether a preventive measure should be taken or a restorative treatment is necessary. So this is the importance of taking the caries risk assessment of each patient. So what are caries risk assessment? So these are validated assessment strategies that allow dental providers to implement a systematic and evidence-based approach to astutely assess and record changes in the caries risk status of patients in an attempt to stop the disease. Okay? So the probability that an individual develops a certain number of caries lesion over a specific period of time is the result of caries risk assessment. So, any method that assess any individual risk or protective factor to predict caries development or progression is considered as caries risk assessment. Caries preventive approaches must be integrated based on the knowledge and understanding of the predicted risk of the patient. Okay, there are two models, okay, for taking the caries risk assessment. Okay, the risk model and the prediction model. So the risk model employed to work out the causative caries factors called the risk factors, but it cannot predict the caries outcome. So risk models counting the multiple variables and in a better prediction because as we all know the disease carious lesion or caries lesion dental caries process is multifactorial. So contribute to a more efficient allocation. This risk model, it contributes to a more efficient allocation of your time and resources for oral health programs by eliminating many unnecessary interventions. For example, the professional topical fluoride applications in a low caries risk child. So when conducting a research, uh, in a particular place, for example in an elementary school, the caries risk assessment is done on all students before providing treatment, before giving topical fluoride applications on each patient, because not all students in that particular school have high risk caries uh, development. Okay, so it is important to know which among the individuals or among the students are high risks of dental caries or indental caries, so that we know who among these students should receive the topical fluoride application. So this way, we can save in terms of finances, in terms of budget, especially for the government, we can save. We don't have to use fluoride for the students who are low risk. So we don't have to use fluoride or topical fluoride unnecessarily, because we already know who should receive okay, who are the high risk individuals in this subject. So this risk model can also potentially promote caries prevention at the primary level itself, because you already know who are at high risk in developing caries. So before the initiation of the disease process, the disease is already detected. So prediction model estimates the danger of caries progression within the future. But the risk model is better because the what do you call this? You can predict who will have the disease in the future, okay, and hence it will prevent that person from having the disease by early intervention. So examples of caries risk assessment methods: the ICCMS, or the International Caries Management System, okay, International Caries Classification Management System, the 4D, okay, the FDI Caries Prevention and Management Form, ADA Caries Risk Assessment for Pediatric Patients, the CAMBRA, or Caries Management by Risk Assessment, Cariogram Model, Caries Assessment and Risk Evaluation, or CARE Test, the Traffic Light Matrix, Cariometer app, and the Lactic Acid Impression. So these are the most common examples of caries risk assessment models. Okay, but I'm going to discuss only a few that are most commonly used in research. So what is the importance of caries risk assessment? So incorporation of caries risk assessment as a motivating tool for patients. So if the patients nga naman already know, okay, their risks, okay, so that will encourage them to undertake the measures that you will be giving, okay, all the recommendations that you will be giving them, that will move them from a high or moderate risk category to a low risk category. So the risk assessment can also contribute to a more efficient allocation of your time, just like what I mentioned a while ago. Efficient allocation of time and resources for oral health programs by eliminating many unnecessary interventions in people who do not need them. So allow dental providers to implement a systematic and evidence-based approach to astutely assess and record changes in the caries risk status of patients in an attempt to stop the disease. Assessment also can potentially promote caries prevention at the primary level itself. So, caries preventive approaches must be integrated based on the knowledge and understanding of the predicted risk. So, number one example is the ICCMS 4D, the International Caries Classification and Management System. This is a comprehensive set of clinical protocols, okay, that address all diagnostic, preventive, and restorative decisions necessary to prevent tooth structure or preserve tooth structure and restore only when indicated. So, but for all these methods, actually, okay, caries risk assessment methods, they believe that prevention is better than cure. So this is the purpose of all caries risk assessment methods. So the different phases of activities of caries necessitate a different management method. So it is important to know, okay, to assess or classify each type of caries, okay, that is present in an individual, as well as to know the risk of the patient in the developing of the disease. Okay, so what's the ICCMS 4D? Okay, the first is to determine, okay, determine the factors present in a patient, okay, detect and assess the caries. Okay, this is the staging of the caries activity, and decide, okay, what treatment to do on a specific patient depends on the assessed caries present on the patient. Okay, and then do. Okay, do apply whatever you have decided, whatever treatment you have decided to do for the patient based on the actual clinical caries present on the patient and the actual caries risk, okay, of that patient. So number one is to determine the patient level caries risk. Okay, so you have to know the risk factors. What are the risk factors present in the patient? For example, if the patient has had a head and neck radiation, okay, so hence if the patient is exposed to head and neck radiation, you would expect that the patient has a dry mouth. Okay, if the patient has inadequate, okay, the patient has inadequate oral hygiene practices, deficient exposure to topical fluoride, high frequency of sugar intake, okay, symptomatic, okay, if the patient has driven attendance, has socioeconomic status of the patient, if the patient belongs to the lower class, okay, these are access barriers to treatment, okay, because of the lack of funds. And if the mother has a high decayed missing field factor, okay, the mother has a high caries experience, it is expected that the child will also have a high caries experience. Okay, so these factors in red will always classify an individual as a high caries risk patient. So once you have determined, okay, if your patient is belongs to the high, moderate, or low caries risk, okay, the next thing you do is to detect and assess, okay, the caries present in the patient's mouth. So this is the caries staging and activity using the ICDAS. So the ICCMS recommends detecting or staging the caries present on each individual using the ICDAS or ICDAS. The next step is, okay, the next step is to decide. Okay, decide based on the intraoral risk factors of the patient. You can decide um, by personalized care plan, okay, with the patient and tooth levels, okay, the level of the patient's caries risk, okay, and the level of caries present on each tooth. This is the decide on a personalized care plan. Okay, so the next thing to do after the decision is to do, okay, to apply whatever the decision that's been made, whatever treatment, okay, that is appropriate for each tooth and for the individual patient. So preserving caries prevention and control interventions management depending on the classification or grading that you have given to each tooth with dental caries. Okay, so do is to do appropriate prevention and preservation interventions on particular teeth with dental caries. So you can do non-operative care control for example, if you have graded or scored 1, 2, and 3 with inactive decay, okay, this can be treated with non-operative care control like fluoride therapy, or they can be sealed with what I call this, spit and fissure sealant. Okay, so and for grades or scores with 4, 5, and 6, okay, this can be treated restorative or operatively. Okay, they can be unless of course if the pulp is already affected, then endodontic procedure should be done prior to any restorative treatment. So next is the Colgate Professional Malaysia Caries Risk Assessment Form. So with this form, okay, it is also recommending the ICDAS visual guide. Okay, you have to write how the number of teeth, okay, the number of teeth that has a score 0, 1, 2, 3, up to 6. Okay, you don't have to write the type, what you call this, the specific tooth, but they are asking you, this form is asking you to count how many teeth that belong to each stage of decay. Okay, then the ICDA's highest code observed, okay, you can write here. And in the step 2, of course, the risk factor assessment. Okay, you can tick the box that applies for the individual, okay, depending on your interview. So if the patient has visible plaque, has no fluoride exposure, crowding, dips and pit and fissure, any dental appliances, and all, okay, all the things, okay, criteria written here are designated for a high risk individual. Now, so for step 3, no, caries risk matrix, okay, a low caries risk patient, if you take less, okay, boxes on the step 2, but if you take more than uh, okay, if initial stage active caries lesions, okay, if there is 0, the patient is moderate risk, okay, is if 1 or 2 risk factors are present, and then the patient has stages 1 and 2 caries, okay, the patient is at moderate risk. So if the patient has 3 or more, okay, tick box on the step 2, and he or she has stage 1 and 2 caries, okay, the patient is considered a high risk patient. So again, the patient is in moderate risk even if the patient has no risk factor, but the patient has 3 to 6, okay, scores from 3 to 6 in his teeth. So the patient is considered at moderate risk. So the patient is considered at high risk if the patient has scores 3 to 6 on his teeth and with 1, 2, 3 or 1 or more risk factors present on the patient. So what are the prevention methods? Okay, for all levels, okay, for the Colgate Professional Assessment Factor, Risk Assessment Factor, okay, for primary prevention on all risk levels, okay, Colgate is recommending to brush twice daily with fluoride toothpaste, and as well as patient education or oral hygiene instruction. So you can recall a 6 to 12 month visits or twice a year visit for low risk patient. Okay, for secondary preventions for the moderate and high risk patient, the Colgate is recommending fluoride varnish, sealant application, diet counseling, okay, sugar free chewing gum, okay, prescribed home fluoride gel, and prescribed home fluoride mouthwash. So recall visits for moderate risk patients is every 6 months. So tertiary prevention for high risk patients, so minimally invasive treatment should be done, okay, depending on the level or the severity of the decay, and like I said, unless if a patient's tooth is already symptomatic, no, with the obvious sign of pulp involvement, so restoration should be done. Okay, high risk patients should be recalled every 3 months as per recommended by the Colgate company. Okay, so the next form is the ADA Caries Risk Assessment form. Okay, this is done for children more than 6 years old. Okay, this is for pediatric patients. So again, you tick the box, okay, that applies. There are 3 categories: the contributing conditions, the general health condition of the patient, and the clinical condition. So Okay, if yes to the first factor, then the patient is low risk. But if no, okay, for example, the contributing conditions, if the patient has fluoride exposure, okay, the patient has low risk. If the answer is yes, and moderate risk to high risk if the answer is no. Okay, the sugar intake, okay, primarily at meal times. If the patient tick the box that she or he only takes sugary drinks at meal times, then she is at low risk. But if the patient ticks the box, okay, that she or he is taking or eating sugary foods frequently, even after meal times, then the patient is considered at high risk. Okay, but overall assessment for ADA, okay, so check the box of the conditions that apply. So a person is considered at low risk if only conditions in the low risk column are present. So if the patient has ticked only a majority of the low risk conditions, okay, but the patient is at moderate risk if only conditions in the low and moderate risk are present. Okay, if majority of the tick box are in the low and moderate risk, and the patient is considered at high risk if all the boxes ticked are both in moderate and high risk. Okay, so okay, so again another example is the FDI, Caries Prevention and Management as chair-side guide. Okay, this is recommended for the private dental practice. So the FDI is also recommending the IC-DAS. First, okay, understanding the lesion activity using the IC-DAS method. So, okay, you have to grade or score the individual tooth of the patient based on the IC-DAS and determine the activity of the caries lesion that is present. Okay, and then next is to determine the caries risk of the patient. So the patient has a low risk in caries if no incipient or cavitated primary or secondary caries lesions during the last 2 years and no change in the risk factors that may increase the caries. Okay. The patient is considered at moderate risk by FDI if one or two incipient or cavitated primary or secondary caries lesions are present, okay, or have occurred in the last 2 years, and the patient is at high risk if three or more incipient or cavitated primary or secondary caries lesions have occurred, okay, in the last 2 years. So additional preventive measures are indicated for both moderate and high risk patients, okay, including patient education like oral hygiene instructions and diet counseling. Also, they are recommending protective factors for the moderate and high risk patients, including fluoride, sealants, and salivary stimulating like chewing gum, okay, sugar-free chewing gum to increase the salivation of the patient. So for the low caries risk patients, no additional interventions are required or indicated by the FDI. Okay, Federal Dental International. Okay, so this is the recommendation as per FDI. Okay, based on the age bracket of each patient. So, by first assessing the risk, uh, okay, level of the patient. Okay, for example, in children ages 0 to 5 and 6 to 11. Okay, if the patient is known to have a long-term consumption of sweetened medication, and if the patient has obesity and illness or disability, okay, the professional maintenance for these patients Okay, from 0 to 5, for example. Okay, for all children age 3 and above. Okay, fluoride varnish application with 22,600 ppm is or should be applied at least twice a year for up to 4 times a year for higher risk children. Excuse me. And the for maintenance or patient education and maintenance for these types of patients, okay, twice daily. Okay, they have to be instructed to brush their teeth twice daily after breakfast and just before bed. Okay, supervised brushing with fluoride toothpaste for by the parents and guardians. Supervised because okay, for this fluoride, remember that 0 to 3 years old should not receive fluoride at all. Okay, fluoride is only recommended to 3 years old and above. Okay, so the range of fluoride toothpaste that these children can use are for the 6 to 12 months. Okay, 1000 ppm fluoride below. Okay, actually 1000 ppm fluoride for 6 to 12 months is high risk, no? High risk because these children may be at risk of fluorosis. Okay, especially their permanent teeth. So, but because they are deemed to have a very high risk, okay, because of this illness and disability, FDI is recommending a 1000 ppm fluoride even at such an age. Okay, so for 1 to 3 years old, the same 1000 ppm fluoride or below. Okay, but it's in a small size, not a pea size. This is just a rice size. No, konting-konti lang. So 3 to 6 years old and below, low caries risk, 1000 ppm fluoride, pea size for 3, 6, and 3 years up. Okay, 3 to 6 years old. Why? They can take or they can use high fluoride content toothpaste because these children can already understand instructions. Okay, they already know how to spit. So this is an example of FDI recommendation. Now for 18 to 69 years old, okay, when the caries risk assessment, if these patients have genetic background, okay, that predispose them to have high caries, mouth piercing, drugs, excuse me, and the cardiogenic diet. So the professional maintenance for this age bracket, okay, for non-cavitated caries lesions, again, topical fluoride varnish application. So remineralizing agents, resin infiltration techniques or therapeutic sealants as if possible, and the lesions requiring restoration should be preserved. Okay, tooth structure should be preserved where possible. Ensure topical fluoride treatment is delivered after restoration for these patients, and seal or repair defective restorations where possible. Replace restorations only when necessary. So this is the current concept, no? It's not because you saw a recurrent decay on a certain tooth, no, with composite restoration, for example. The current concept is to not remove the entire filling and replace it with a new one. You have to assess it properly if the caries is assess properly where, okay, the depth of the caries is. So if you notice or if you are sure that the caries has a no, or the tooth has a residual caries that has been activated, for example, then I think that's the time that you replace the entire filling. But if you notice that the caries, the recurrent caries is just at the surface or it has been arrested, then maybe you can just scrape that area with a burr, okay, and do it conservatively just to seal the surrounding area where there is leakage. Okay, so the CAMBRA or the caries management by risk assessment. So CAMBRA was developed in 2002. This is a reliable patient-centered approach, okay, caries risk assessment. So it takes the patient's health and lifestyle risk factors into consideration, okay, just like the ADA. So it is also based on a peer-reviewed publications that look at caries assessment and the impact of saliva and nutrition in the caries development. So this is an example of a Canberra caries risk assessment form. So there are disease indicators, biological or environmental risk factors, and the protective factors from column 1, 2, and 3. Okay? So, disease indicators is for column 1, biological or environment risk factors for column 2, and protective factors for column 3. So, accordingly, for Canberra, okay, this mimics the caries balance na. So if the boxes on the column on the protective factors, okay, it has been ticked more, okay, or the protective factor is present, okay, is the patient is tick 4 or up, and only tick a few on the column 1 and 2, okay, which are the disease indicator factors and the environmental risk factors. If there's more on the protective factors, then the patient has a low risk level, okay, but if there are more yes on the column 1 and 2, means that the risk factors are heavier, okay, the disease indicators and the environmental factors are heavier than the protective factors, then the patient is at high risk. So yes in column 1 indicates a high or extreme risk. So yes in column 2 and 3, consider the caries balance. So the final overall caries risk assessment category: extreme, high, moderate, and low. So accordingly, so patients are divided into 3 groups again. So based on their risks of developing the dental caries, the high, moderate, and low risk, even extreme, okay, maybe extreme if all the disease indicators are present, and all the biologic or environmental risk factors, okay, that predispose them to developing caries are all present, then the patient maybe is at extreme risk of caries development. So this Canberra allows for a tailored preventive counseling and action based on the individual risk level. Okay, so determining the caries risk as low, moderate, high, or extreme, just like the caries balance. If the protective factor, there is more protective factors, then there is no caries. So there is more disease indicators and biological factors present, then the patient is at higher risk. So adapt the number of yes checks for each of the disease indicators in column 1 and risk factors in column 2. Then offset this total by the total number of yes. So checks for protective factors in column 3, use these numbers to determine whether the patient has a high risk factor score than a protective factor score or vice versa. So use the caries balance to visualize the overall result and determine the risk level. So what is the goal for the dental professional, the current concept? Dental caries never progresses beyond the moderate caries stage for patients who are routinely seeking dental care. So what is needed to achieve this goal? Okay, our goal is that to not allow, okay, the progression of caries beyond the moderate stage. Okay, especially for our patients who are always routinely seeking our care, okay, who are always visiting us for oral prophylaxis. So what is needed to achieve our goal? Early detection and staging of caries lesion severity and activity. Okay, and then caries risk assessment of the patient and tooth surface level, doing the risk-based preventive intervention before caries progresses to the cavitation stage. So, this slide is a lecture from Evidence-Based Caries Prevention Strategies by Dominic Zero. Okay, so that is all for caries assessment. Later on, I'm going to discuss about the prevention and management of dental caries.